So thank you all for being here. My name is Jody Jepson and I'm one of the housing directors at Heading Home. We are very excited to show you what several of the talented volunteers have been working on for us, as well as share the results of the most recent cost study. Excuse me, I do stutter, so I'm just going to bear with me here. So we're really excited to release the costs study and show the work of the amazing volunteers. As most of you are probably aware, the last cost study by UNM's Institute for Social Research done in 2013 concluded that it's 32% cheaper to house someone through our initiative than it is to leave them homeless. This means that we are saving the taxpayers millions of dollars. Cost savings are generated because we are placing high utilizers of our system into permanent and supportive housing. So essentially, we take the most complex cases of homelessness, the people that are most likely to die on our streets, and we work to get them housed and linked into resources. And that's why the mayor describes this initiative as the smart way to do the right thing. So we are so happy and honored to have our valuable partners here with us to celebrate the impact that we are all having. We are changing lives and bringing hope to people who We are changing lives and bringing hope to the people who thought that they were lost, forgotten, and invisible. So I'd like to take a moment and acknowledge our partners. Some of our case management staff, I think, is here. Supportive Housing Coalition, the New Mexico Coalition to End Homelessness, AHH staff, all their hard work and dedication in restoring the lives in our community. So at this time, it is absolutely my honor to introduce Mayor Richard J. Berry, who founded the Albuquerque Heading Home initiative in his office and then selected us at Heading Home to implement the program. Mayor.
That's one of my favorite people on earth. Jody, thank you so much. Thanks for educating me. I knew Jody when she was with APD. She was on the Coast team, and she was really part of that group that educated me as a new mayor that wanted to try to do something different than we'd been doing them. And so thanks for your leadership and your passion for this. This is someone who's actually dedicating her life to making a better day. So I know literally now, I've been mayor 7 years, I know hundreds of mayors around the country. And the ones that I like and the mayors that I look to as true leaders are tired of sweeping tough problems under the rug. You know, we've gotten to a place in America where everybody wants to push something off to the side. Everybody wants to push a person off to the side. Everybody wants to squeeze that balloon and make it go somewhere else. And the thing I'm most proud about Albuquerque Heading Home is that we made a conscious decision as a community that we weren't going to kick the can anymore. We were going to take partners who are in this room today, who are doing this important work long before I was the mayor, and they'll be doing this a long time after I'm the mayor, and use their ability and talent and passion and try to have a collective impact on this problem of chronic homelessness. And it's not just a problem from a human standpoint. The human stories of suffering will tear your heart in two. But it's also a story about resources. And that sounds like they don't go together, but they do. When we started Heading Home, the question I asked was, is there a smart way to do the right thing? Raise your hand, everybody in town, if you think the right thing to do is to get somebody who's chronically homeless, medically vulnerable, who's been on the streets for 20 years, who's literally struggling to survive every day, is it a good thing to put them into a house? Every hand goes up, right? Every hand goes up. But then you ask them, well, what if I told you we could save money, taxpayer resources by doing that, and then take those resources and plow them back into our community through public safety, through drug abuse programs, through mental health programs, whatever it is, and get a double bottom line out of this thing? And everybody said, well, that would be great. And what we did when we started Heading Home was we made that promise to people. We told them we think this will work. We think we can save money. And the good news is Dr. Gehring, who's just a tremendous researcher at the University of New Mexico, was hired to do what Jody told you about a minute ago, which was study the first 50 people. I think there was a cohort of 50. Just to see if it was moving the needle. And the answer was, yeah, we can house somebody for 31.6%, if I remember, less than we can leave them struggling to survival under an overpass. Well, now we have the follow-up study. So the right thing to do then is to inform yourself with data several years down the road. So we now are 610 people and their families who have a roof over their head in Albuquerque tonight because of Albuquerque Heading Home. And that's awesome. We have 600 or so more that need a house. Okay, so we're not done. This isn't about, wrap it up, put a nice bow on it. This will be going on forever. There's always somebody that needs help in our communities. So we asked Dr. Gehring to come back in and basically say, okay, now years later, I think you studied, 320 people or so? He'll give you the details. Several hundred people now that have been in the program for multiple years. And the short answer is we've saved our community around $5 million. $5 million that can now be put back into services and into making our place a better place to be. I'll let Dr. Gehring give you the basic data on this thing, but the short answer is I have mayors now. Anaheim, California has a program like this. Lexington, Kentucky, Mayor Gray's been out. Mayor Tate in Anaheim adopted it. Mayor Gray's looking at it. Other mayors around the country are looking at programs just like this because we've been able to do the hard work in Albuquerque. You have, our community has, and now we can lift this program up to others. So I just want to say how humbled I am as a mayor to live in a place that cared enough to do the hard work. And that includes people like Adria Malcolm, Adria Juan, is it Labreach? Help me. Labreche, thank you so much. Nick Van Diver. Nick, thank you so much. Summer Smith, thank you so much, Summer. And then, of course, Brianna Anderson, who used to work for us in the mayor's office and who left us to go be the communications director. Where's Bree? Right here. Yay. Thank you so much. We miss you. Jody Jepson, I already mentioned. Of course, Jennifer Metzler, Healthcare for the Homeless, everybody there. I got to tour Healthcare for the Homeless when I was a state legislator. Changed my way I saw the world. Republican shows up to Healthcare for the Homeless, you're going to get a little bit of an education. If you thought you were like kind of a, just the fiscal guy. And that really helped change the way I try to govern. Doug Chaplin, our head of family and community. Doug, thank you so much. Robin Otten, who basically spent midnight after midnight with me, even fussing over the name of the program. Thank you, Robin. Imagine telling your story if you've been on the streets for 20 years. They had the courage to join a program that they didn't know much about. They had the courage to talk to their brothers and sisters on the streets and tell them about the program. And then they had the courage to just be well. These savings come because people aren't going to the emergency room like they used to. People aren't having crisis on the streets every single day. It's our participants that have created these savings, and they are leaders. And we should look at them as leaders. So I want to thank each of you personally. And God bless you, and let's keep this going. We spun this out of the mayor's office a couple of years ago. So we started it in my office, we incubated it, we got it going, and then it's no longer in the mayor's office because this needs to survive after I'm done being your mayor. And the Albuquerque Heading Home folks are doing a great job, so God bless for what you're doing, and thanks for letting me come by and help you celebrate today.
So now I'm extremely happy to take this opportunity to introduce Jenny Metzler. Jenny is the Executive Director for our partners at Albuquerque Healthcare for the Homeless. She was intimately involved with the launch of the Albuquerque Heading Home initiative. She played an important part in securing the seed funding for the program. And our organization collaborated with us on the video that you'll be seeing here soon. Miss Jenny.
I've had the opportunity for all these years now to talk about this publicly, but I've never followed Mayor Barry, so I don't know that there's much more to say. I think he outlined how this happened really beautifully. But what I'd like to say, you're going to hear things from Dr. Guerin that are numbers that are very compelling, and you're going to see things on this video that I believe will evoke emotion from every single one of you. But what I want to say is this takes time, and that this has happened in 5 years is really phenomenal, and it was a difference in our community after decades of trying to address this problem of homelessness that frankly many people thought was just intractable. And there were among us those that believed, that had heard stories, that had been helping people, that had been trying to address the policy solutions and the funding solutions, who just really believed that we didn't have to accept homelessness in our community. And we talked about it and talked about it. We had a plan. We kept bringing it forward to people, and it was really when Mayor Barry came into office, and Robin and Doug and community providers all were just ready to come together and generate some political will. And the political will generated the community will. We had all the pieces. So we believe that. Fast forward 5 or 6 years, not so fast, actually. These years later, there was a lot of hard work, a lot of wrangling, coming to philosophical agreement, coming to look at the evidence to figure out what we thought would work. We continue to believe, and now today, we don't just believe, we know that this can obliterate and end homelessness for individuals in their lives and for our communities. So we're honored. Albuquerque Healthcare for the Homeless has been a part of this conversation for a long time, and we are committed. Our leadership, our board of directors is meeting in an hour. They'll be really happy to hear this update, and we're committed to seeing this one through for as long as it takes. So thank you for having us.
I have had the pleasure working with Doug for over 10 years. Doug Chapin is the Director of Family and Community Services Department. The contract that we have with the city with them is to run Albuquerque Heading Home, where it provides funding for permanent housing and case management. So we really appreciate that. So if you all could please help me welcome Doug.
Wow, what a great honor and pleasure it is to be here this afternoon. Thank you all for coming out. I just want to take a moment and thank the mayor for his leadership in helping create really smart social solutions for the city of Albuquerque during his tenure. He's just been a great leader in that particular area. You know, as the director of the Department of Family and Community Services, I'm frequently asked about people experiencing homelessness. And there's the reason I'm asked that is that there's a lot of genuine concern amongst the public for these individuals that are out on the streets. And so I'm also honored to work with organizations like Healthcare Supportive Coalition of New Mexico, Heading Home, to make a real difference in our community. And we continue to work closely with all the partners of Albuquerque Heading Home when addressing homelessness. This partnership was actually solidified on a cold January night back in 2011. And since that time, there's been a lot of positive work done in the area of helping individuals. To ensure that work is being done to produce the desired results, Family and Community Services has hired the Institute of Social Research, Dr. Paul Guerin and his organization, to do a cost study, and the mayor has talked about that a little bit. And the reason this is important is when we do these social programs, we have to have benchmarks, we have to have measures so that we can judge how we're doing. You know, do we need to go right, left, straight ahead? And it also helps the public understand, it paints a picture in their mind, the benefits across the board. You know, when people are spending less time in ERs and more time in their home and more time going to inpatient or outpatient care like people that are housed, that's a very positive thing for our community. So today's event is a step towards also breaking the stigma around homelessness. Part of this movie, I think, will help describe that. So I would like to introduce Dr. Paul Guerin to talk about his recent findings and the successes of the City of Albuquerque and Albuquerque Heading Home partnership.
I'll talk briefly about the study and some of the findings we have, but I think initially it might be important to point out that Albuquerque took a unique road on this in terms of research, I think. It's slightly unusual what Albuquerque did. Albuquerque didn't have to go this route. So normally what we find that research comes after the fact. In fact, we don't know what the cost benefits of programs are, and it's really hard to self-correct or understand how programs should work if we don't do these kind of things at the outset. And so Albuquerque had this unique opportunity, and they in fact took this unique opportunity to study a program like this in a couple of different ways, but with a focus primarily on cost. So what we really want to know in this type of program is we want to know not just the economic cost. That's what I'm going to talk about today. So what I'm going to talk to you about today is I'm going to mention some of the economic savings we have. What we're not able to calculate, and what's equally important, but very difficult to do, is to actually calculate social costs. And social costs, in my view, in some cases, are much more important than solely economic costs. Combined, they tell a much better story. Today, we have the economic costs. In my view, even if there weren't an economic benefit, there would still be a reason perhaps to keep a program like this for the social costs of this or the social benefits of that. So again, I'm going to talk about the economic costs. So what I'm going to do for you is there is a full, long report that I'm not going to talk about because none of you would want me to talk about that. And Doug actually said, I asked him, how long do I have? And Doug said, you can take 45 minutes. And I could take 45 minutes, but that would be a mistake. So what I'm really going to do is, in addition to having these full, longer technical reports that we create, we oftentimes are doing smaller executive summaries. In my business at the Institute for Social Research, we typically call these reports and briefs. So that's what I'm going to talk to you about today. And it's a 4-page report. And even more briefly than that, I'm not going to talk about 4 pages. I'm just going to talk about these columns here on the side. So what I'm going to talk about is I'm just going to mention some of the main findings that we have. So as noted before, this study began at the inception of the program, which began a number of years ago. And our goal was to gather people together who had been housed and follow them from one point in time to a future point in time and actually look at costs that were generated by those individuals in the system that I'm going to talk about. So what we actually have here is we have costs for them before they were in the program, and we have costs for these individuals after they were in the program for the same period of time. And for individuals who participate in our study, and this is important to point out, is we have an institutional review board that allows us to do this kind of research in particular ways, and we had the ability to do that, and we had the consent of people who participated in this study to actually collect information about them and use that information about them and report it about them, not individually. So we're not mentioning individuals, but in the total, in the aggregate. So I'm just going to run through some of the findings. And what we have here is we have people in our study, there's 95 people in our study who were in our study between 2 years and 3 years. So what I'm going to talk about is I'm talking about people and their costs 2 to 3 years before they were in the program and 2 to 3 years after they were in the program. What we found, and this has already been noted, on average, there is a cost savings of particular costs, and I'll mention those, of almost $15,000, so $14,700. These costs include things like emergency room visits. They include inpatient hospital stays. They include shelter stays. They include visits to the jail. They include outpatient visits to the hospitals. They include mental health. It includes medical health. And I'm sure there's some stuff I'm forgetting. One other thing is ambulance costs. So we have these kind of standard costs on these people. So we know that in this time frame that we're looking at, we save on average about $14,000 on people, on each individual. Put that in perspective. What we know is that, let's look at some of the data here. So emergency room costs decreased by almost 77%. So what we know is that before and after, emergency room visits decreased by about 77%. Ambulance and emergency room costs decreased by about 32%. Jail costs decreased by about 56%. Hospital inpatient costs decreased by about 56%. We also know, and this is important to note too, is that some costs actually increase. And we should expect this to happen for this population. We should expect that outpatient medical costs for these people increase. So now, prior to being housed, they were not stable. They didn't have a place to go to receive medical services except emergency rooms. And now, in fact, what we find is that once people are stabilized, they in fact can they can access outpatient medical services that they weren't able to do before. We should expect to see increases in some costs. We also see some increase in costs that are these social services. So now they have the ability, because they're stabilized, to actually go to places like healthcare for the homeless or other places where they can actually, and you could speak much more completely about this, but case management services, kind of art therapy type stuff where they can go and they can drop in. So I think those are some of the primary findings that we have, and I think just to conclude this, and I can answer questions if people have them, but just to conclude, I think what we clearly need to understand is that in programs like this, it is the responsibility of government to actually study these programs and to better understand how these programs operate and whether there's benefits to these programs. And where we find that in fact there aren't benefits, whether they be cost benefits or economic benefits, social benefits, or in how these programs operate, governments and citizens have the responsibility and opportunities to adjust these programs. And when programs don't work, government has the opportunity to actually change these programs. So if there wouldn't have been a benefit here, I'm not suggesting that we would have changed this program, but it would have given the information to the government to help them understand this. In my view, really what should happen is information should inform the decisions we make. They don't necessarily have to drive it, but I'm an advocate of information informing decisions. And here's a case where we have information that something actually works, and that information should inform government efforts, whether they be city, county, state, or national. In fact, our report and our findings lend to the national picture, I think, to actually expand or think about creating these programs in different ways. Thank you.
So here we are today. Yeah, it was, I guess, the winter of 2013. I was the volunteer coordinator, and so sometimes on those winter days, there aren't too many volunteers that show up when it's cold and windy in New Mexico. But one of my go-to volunteers was Juan Labreche, and on the particular winter day that this all started, he came out. Chandler and I were meeting out at the prison to load this big moving truck with probably 20 mattresses. And Juan started shooting that day, and I think a lot of the photos from that day were really dark and kind of moody. As the day progressed, we moved these beds from the prison to people's homes, to our neighbors here with Heading Home. And we realized at the end of the day that we didn't get any photographs of the neighbors of our subjects. And I think part of that was because we were compelled to actually just engage with them and hear their stories and help do a few things to set their house up a little bit better. And I think that that's sort of at the roots of this project, is that more often in journalism, the photographer is just taking that shot, but in this case, we're more compelled to hear the stories and to kind of have a greater ethical standard to present these stories. So after we went out and we did a lot more shooting, you'll see some of these photos that we have for you, and I think it's sort of a culmination of a lot of hard work from the volunteers at Heading Home. We have these UNM doing this data-driven statistics that help support this cause. We have the mayor and municipal government supporting the nonprofit in this sector, and we have UNM alumni like myself and Chandler here still working on these projects, and I'm just incredibly grateful to be a part of this. I think the work speaks for itself, and I hope that some of the darkness from that prison and then some of the beauty that we saw in making those deliveries, somewhere in the middle there in that challenge and those struggles are the stories that you'll see today. And we hope that we can present an honest and real window into that, and that you can all enjoy and be compelled to maybe purchase some of these beautiful photographs that'll go back to support Albuquerque Heading Home and to support the artists who worked really hard on this project. Again, thank you all for coming out. Thanks to Rick Rennie for opening up this space so that this art could have a home for tonight. And in particular to Chandler Smith, we were there from the beginning on this, and we moved countless beds, and it's great to see you here, and thank you for all your hard work, man. All right, thanks to the creative team. You know who you are.
First thing you have to do is get people off the streets and get them stabilized. Sometimes when someone's chronically homeless, you don't have days and weeks. You may have hours to get this person in a place where they want to get off the streets. One of the first things that they ask for once they get stabilized is, how can I help somebody else?
Initially, what led to my homelessness, and at the time I probably didn't even realize I was homeless, was addiction. I work with Albuquerque Heading Home clients, and I'm a caseworker here at Albuquerque Healthcare for the Homeless. I could tell them, yeah, I did it. To keep your housing and keep everything else. You can do it too. We need to get some food?
Oh yeah. I always say I'm gonna go home. Anywhere you put your head is home. I lived in a cemetery for 8 years, and that was home. Or that I lived in the field, and that was home. But like to have 4 walls and a roof, it's my home. It's my home.
Oh, my daughter was scheduled for
my heart. Look at Donna's heart was tick tock, tick tock, tick.
Yeah, she's got a chance. She's got a future. I think because of the house. To have those basic needs met, then you can focus on recovering your life, you know, moving forward.
It's been proven based on the Housing First model that if you provide an individual with a home first and then provide supportive services, they decrease their drug and alcohol use. They become stable on their psych medications. So Albuquerque Heading Home, the initiative was developed by Mayor Richard Berry in the city of Albuquerque to provide quality of life for individuals who are experiencing chronic homelessness and who are medically vulnerable. It's not just about housing people, it's about how we're impacting and providing opportunities for our folks to smile, to get up each day and hopefully have a good day.
Without Heading Home, I would be out there. They do incredible things for us. And they give me their friendship, and they're there for me.